Hi everyone, welcome back to my YouTube channel. Today I'm going to show you which forceps to use on the upper right quadrant or the first quadrant, and then the second quadrant or the upper left quadrant. Okay, but before we proceed, please again click that like button and also subscribe so you will not miss my future videos. And if there are topics you want me to cover, write them on the comment section. If I will be able to answer them, I will do my best. And yeah, let's start. Okay, so these are upper forceps, upper molar forceps, I should say. Okay, so this one, how do you know what forceps is this? So this is a forceps used to extract a molar teeth on the first quadrant or the upper right quadrant. Okay, this is used to extract first molar, second molar, and third molar, or 1/6, 1/7, and 1/8, or upper right 6, upper right 7, and upper right 8. Okay, so how do you know that this is for the first quadrant or for the upper right 6, upper right 7, and upper right 8? In some forceps, there are numbers on the handles. Okay, for the upper right, some is written there, like this one here. It's 18R. So the R means the right side. But you have to know which what number is 18, or where number 18 is what. Is it upper right or upper left or that kind of thing. So 18R means upper right quadrant. But what if the forceps doesn't have any number on the handle? In forceps, all you have to remember is the beaks of your forceps. Okay, so if you look at this forceps, this part here is a bit rounded, or however you look at that, it's a bit flat. But if you look at the other side, this is what we call a beak. You know, it's, if you can see, it's pointed. Okay, it looks like a beak. That's why they call it the beak, that one. Okay, so if you're looking at this forceps, you always look at the beak of the forceps. Okay, this one here, the one with the pointed end, that's the beak. You always remember that the beak is always towards the cheek of your patient. That's why they say beak to cheek. Okay, so if this forceps, if your clinician is using this forceps, if you are not a clinician, if you're a dental nurse, if you're a dental student, a dental assistant, this is how you will learn, or how you will identify. Okay, so the beak is towards the cheek. So if your clinician is extracting an upper right molar teeth, this will be towards the cheek of the patient. Okay, so in dentistry, your right hand side, your reference is, you're always facing the patient, you know. So your right hand side will be your patient's left, and your left hand side will be your patient's right hand side. Okay, so I'll show you a cast here actually. So so say for example, this is a patient's mouth. So if you can see, that's the central incisor. So these are the although this is not a very complete cast, so it's not really ideal. Anyway, we have a first molar here. This is a first molar, a 1/6 or an upper right. Okay, so if you're facing the patient, this is the cheek side of the patient. Okay, so this is the patient's right hand side, and this is their left hand side. So if the clinician is extracting an upper right tooth, so if you can see the beak, so if, for example, they're extracting a first molar teeth, the beak, which is this one here, will always be towards the cheek area. So imagine my thumb as the cheek of the patient, like that. Okay, so see, the beak is towards the patient's cheek. All right, if you try it on the other side, which is the upper left, if you try this forceps on the first molar, okay, look, the beak is not towards the cheek, so that's wrong. So that is not your the forceps for your upper left or your second quadrant. Okay, because the beak is not towards the cheek. So that's the way how to remember it easily, beak to cheek. Okay, so this is a different style of a forceps. I mean, different in the handle. It's still an upper right quadrant handle, a forceps, I should say, but it has a different handle. This one has got a different handle. Okay, but the beak are still the same. See, it's on that side there, on that side there. So you remember, beak to cheek. Okay, now I'll show you the forceps for the upper left quadrant or the second quadrant. Okay, if you see, where's the beak? That's the beak, the one with a pointed tip there. Okay, so this is for your second quadrant or your upper left quadrant molars. So if you can see again here on the cast, say for example your clinician is extracting the first molar or the upper right or the 1/6 tooth. So if you can see, if you imagine my thumb as the cheek, if you can see your forceps, if the clinician will engage the forceps, if you can see the beak, it's towards this. Say for example, this is the patient's cheek, my thumb. If you can see, that's the beak there. The beak is towards the cheek. Okay, so that's the easy way of remembering which forceps to use on your molar, on your upper molar teeth. Okay, so this is for the upper left. If you can see the beak to cheek again, and if you can see the difference here, this is your upper right. Okay, there you go. There's the different one with the different handle, but the beak is there. If you can see the difference, this is for your upper left quadrant, and this is for your upper right quadrant or the first quadrant, and this is for your second quadrant. This is to extract the molar teeth on the upper jaw. Okay, so hopefully, or please make a comment if you understood, and if you didn't, if you can write some questions in the comment section, I will try my best to answer them. Okay, don't forget to subscribe, and I shall see you again next time. Goodbye.